started with some dizziness. The dizziness would last up to almost a week and a half.
And they can look at my mouth and say, we can see there's a problem, but we can't figure out what it is.
I started having really bad headaches, and I was numb from the waist up, and couldn't sleep. It was like insomnia.
But I did have a problem with GERD, which is gastroesophageal reflux disease, which is pretty bad at its worst.
I ended up not going to work for about 5 or 6 months because of that, because I couldn't even walk.
And gastric juices go up into your lungs, and when you do that, you get some bad asthma symptoms.
Chiropractic is based on the premise that a properly functioning spinal column is a necessary component of good health. Your spinal column is made up of 24 movable bones separated by cushioning intervertebral discs that act as shock absorbers for the spine. Just as the skull provides the protective covering around the brain, your spinal column gives protection to your spinal cord. This bony architecture provides the protective support of the nervous system while allowing movement necessary for your everyday activities. Your nervous system controls and coordinates the function of virtually every tissue and cell in the body. Through a vast network of nerves, the brain sends messages to different parts of the body to regulate the function of our body. Muscle movements, coordination, breathing, and blood flow are all controlled by the nervous system. Housed within the bony architecture of the spinal column, your spinal cord acts as the switchboard for messages arising from the brain and messages coming back from the body. Through the delicate spinal nerves that exit the spinal column at each level, communication between the nervous system and the body takes place. Looking closer, these nerves supply the joints of the spinal column as well, including the discs and the joints in the back of the spine. From the front, your spine should be straight, much like supporting beams, and from the side, your spine is composed of 3 curves, one in the neck, one in the middle back, and one in the lower back. Like the curve in a bridge, these curves provide the structure and support your body needs. Injuries, everyday activities, or poor posture can cause the spinal bones to lose their proper position, which causes nerves to become irritated, setting the stage for spinal problems, including pain.
About 2 years ago, I started with some dizziness. The dizziness would last up to almost a week and a half. It would happen about every 3 months, almost right on the dot. In that period of time, I wasn't able to work or do my job because I was flat down. Had to have help going to the bathroom, just to get up and get food, because I would just spin and I'd hit the walls and fall down.
What really bothered me, a lot of times I couldn't go outside or laid on the couch all the time. I was in lots of pain. I couldn't see sometimes. The pain was really intense.
I first went to Dr. Covington because my husband told me to go. I didn't really have back problems that bothered me, but he said I should go, so I went anyways. And on that first visit, Dr. Covington asked if I had any chronic problems, and I told him about my jaw problem. For probably about 20 years, my jawbone has been resorbing, vanishing into thin air, and so the gums follow it, and has resulted in loose teeth all over my mouth.
In April, I ended up waking up and finding my body, my hips were out of joint. They said it was my sacroiliac was out of joint. I couldn't move. I was bent over. So I went into the doctor, and he said my sacroiliac joint was out and that I needed to go to therapy and get it put back in. So I went to physical therapy, and they put it back in for me so that I could straighten up. I ended up not going to work for about 5 or 6 months because of that, because I couldn't even walk.
Had some severe back problems, and that's how I ended up being introduced to Dr. Covington. I went with her while she was being treated and found out that, you could get a introductory examination and stuff like this and diagnosis as to any problems you may have. Well, I really wasn't planning on going to a chiropractor when I went with her or anything else. But I did have a problem with GERD, which is gastroesophageal reflux disease, which is pretty bad at its worst. Talked to Dr. Covington. He took x-rays, gave me a diagnosis that I had subluxation, and I told him about my GERD problem and asthma problems that I had. He said, I think I can help you here.
My periodontist told me to pull all my teeth back in 1990, and I told him no. I said, you do your job, I'll take care of things at my end, but no. And I've actually gone to periodontists that specialize in rare and unusual periodontal diseases that talk all over the world, and they can look at my mouth and say, we can see there's a problem, but we can't figure out what it is. So it has no name. I've taken drugs, nothing touches it.
When it got really bad, I would always just have to lay down because I couldn't get up and walk anywhere because I just hurt too bad and I couldn't see and pass out. When I get up, I'd pass out. I
was just in so much pain. Nothing was working. I had a hard time going to work. I missed 6 months of work and just would go back maybe once a week or so, and I was just in so much pain. The dizziness was still there, every time I laid down, every time I stood up. It was just awful. Well, in January, we had a flyer in our newspaper, and it happened to talk about Dr. Covington, and in that he talked about different testimonials from other people that had had certain problems about the same as mine. And I thought, well, you know what, it can't hurt me for $15 to come in and have an exam and x-rays, for him to consult with me and let me know what was going on. He also said that if he couldn't help me, he would let me know.
Covington, he started treating me, and immediately I actually started feeling better as far as my shoulders and muscles loosening up. And I noticed a little bit of GERD was going away. And so I continued the treatments, and after about 2 weeks or 3 weeks, I actually noticed that I was having less and less problems with my GERD problems. And GERD, when it does really get bad, what it does at its worst is it will go up into your lungs or aspirate in your lungs because the esophagus loosens up or relaxes and lets the gases and gastric juices go up into your lungs. And when you do that, you get some bad asthma symptoms, and it's pretty darn uncomfortable.
I couldn't do anything. I couldn't go work out. I couldn't going out with my friends or anything. So I was always inside, laying on the couch. I couldn't do anything. I couldn't eat or anything like that either because I was numb. And so I would drop and spill everything.
He also said that if he couldn't help me, he would let me know. So I thought, okay, I'll come in there and I'll see him. And I saw him. I felt very confident with the words that he had to say. He said he could probably help me. And within about a couple of weeks, I started to see big improvements. My dizziness went down to nothing. I wasn't even dizzy anymore after about 2 or 3 weeks. My back pain was so much better. I could move and function. I went back to work. I also, with having menstruation that women have every month, the cramping would be so bad that I could not move either. My back would be so bad with my disc that I could not walk. I was not able to do the functions that I normally do during that period of time for that week. Now that he's got me back in line, my back happened to be out of place and it was shifted to the left. My hips were, and so by putting me back in line, I was able to function and I do normal things now. It's great. I'm an avid hiker and camper, and we love to go hiking, me and my husband, and now we're able to go do that because I was not able to do that as of last year. I could not even walk. So for us, it's just been a new beginning, and I just love the way that I've been feeling, and I'm back to normal, and life is great.
The pain has been horrible. It doesn't hurt other than when I brush my teeth, but when I brush my teeth, the pain is like on a scale of 1 to 10, it's an 8, 9, and 10. It's like if you have a splinter in your finger that's gotten infected, and every bristle that touches your gum is like touching that infection. It's horrible.
Yeah, all of a sudden just hit. And I didn't do anything that I know of to, like I didn't fall down, and then the next day I just all of a sudden one day just, it felt good.
You feel good now, so
I started having really bad headaches, and I was numb from the waist up, and couldn't sleep, was in insomnia.
I slept very little at night. I would sleep maybe 3 hours. And that was about it, and I'd be up the rest of the night.
We went to Dr. Covington. I told him about it, and I said, can you help me with that? Because I didn't think that really falls into what chiropractors do. And he said, well, we'll just wait and see. And after about the 3rd week of getting treatments from him, I noticed the pain was less in my gums. And 5 months after I was treating him, the pain kept diminishing over the months. And until I got to the point where about 5 months after I'd started going to him, my pain on a scale of 1 to 10 had gone down to about a 2.
Well, I do stuff all the time. I can go do stuff all the time. I can eat normally. Because when I first was, I've been numb and have had headaches for like 6 years now. And I can eat just fine. I can drink just fine. I can pick up things and feel them. Before I burn myself when I get in the tub or stuff because if it was hot or cold. And so now I can burn myself curling my hair and stuff because I couldn't feel anything touch against me. So I can pick up things that I can before I couldn't judge how to pick it up. I can go work out. I can go hang out with my friends. So I don't have to worry about getting a headache and passing out while I was driving home. So I can sleep now. I used to have to take tons of sleeping medication to even be able to stay asleep for a little while. But I can sleep now, not being on anything. I don't have severe headaches anymore. Because I used to have 24-hour constant headaches. Not having anymore.
When it was bad, it was like a 10. It was as simple as that. And then after Dr. Covington treated me, and when it actually started getting good, and then when it really started to diminish, it went down to about a 2. And sometimes it actually went down to 0.
And my periodontist actually said, we don't understand why our treatments don't work with you. It works on everybody else. Why not with you? But now I know why. The problem wasn't with gum disease. The problem was with bad spine that was in the wrong position.
When my mom first told me about going to a chiropractor, I said, I don't want, because I've heard so many, just the Crocs, don't go to them, But I've gone to all the other specialists and all the other doctors that are supposed to help, and nothing at all helped. And this is the first thing that's helped.
That's much better. And another side effect, which I hadn't even mentioned to Dr. Covington, was that I've had hypoglycemia for years. And when I was a cashier, and now I'm an interpreter, and so I have to take what's being said to me and turn it into the target language right away. And you have to really concentrate so you don't miss anything. And when I hadn't eaten for a while, or if my call went over, or missed a break or something, I would get fuzzy and dizzy, and the world would kind of be gray. And that went away after 5 months. That went away. And I wasn't looking for anything like that to happen. Now, if I don't eat between 9 a.m. and 5 p.m. because I miss a meal for some reason, I still think clearly. I can still do my job well, and I'm not battling with weight. I've always kind of had to watch my weight. And because I don't have hypoglycemia, don't have to keep up on my calories so that I don't get fuzzy-headed, I can just eat when I get hungry. And so my weight stays comfortable weight without me having to do anything about it. Those of you that battled weight like I have since I've been 16 years old, that's really nice not to have to battle it anymore.
One day my parents were looking through the newspaper and they saw an ad that he sends out in his newspapers, and saw it and decided to call up and try it out, and that just ended up working. And I've been going to different specialists for years. Nothing's ever helped. And then all of a sudden, just see this in the newspaper, and I go and I can feel I don't have severe headaches. I can sleep. Pretty normal.